Well, good afternoon, everyone. We'll go ahead and get started, and thanks so much for coming out on your Friday afternoon. I am Emily Tanner Smith from the University of Oregon, and so today we've got an exciting panel ready for you to discuss the state of the brief alcohol intervention literature, and really what we'd like to focus on are some innovative statistical methods using individual participant data, meta-analysis, and thinking about how we can move the field forward. And so this is particularly relevant given the topic and the theme for this year's conference of Big Data in Prevention Science. So we will ask you to hold your questions until the end in the interest of time, and so we hope to have a good discussion with you after the three presentations, and then we'll have a discussant at the end as well. So today I'll first be talking about the current state of the science of brief alcohol interventions for youth. And before I begin, I'd like to acknowledge the generous support from NIAAA for this research, and then I'll also declare that my co-author and I have no conflicts of interest. So it should be no surprise to us as prevention scientists that heavy episodic drinking and heavy alcohol consumption are critical public health issues for adolescents and young adults. So according to recent estimates from the World Health Organization, in 2016, approximately 5% of all global deaths and 5% of the global disease burden were attributable to harmful alcohol use. And so we know that it's not alcohol use per se that is problematic, but really it's that heavy or excessive use, i.e. binge or heavy drinking. And that excessive use of alcohol is associated with numerous detrimental consequences, including risk for drunk driving, traffic deaths, unintentional injuries, assault victimization, and a range of other social and mental health issues. And so what we know is that this heavy episodic drinking does tend to peak during late adolescence and early adulthood. So recent estimates from the National Survey of Drug Use and Health from 2017 indicate that among students ages 12 to 20, approximately 7.4 million reported drinking alcohol in the past month, and then 61% of those current users did report past month binge drinking. And we know that this heavy episodic use does tend to peak in late adolescence and early adulthood, with over 19 million participants ages 18 to 25 reporting past month alcohol consumption, and the majority of those reporting past month binge use. So one potentially promising strategy for addressing risky and excessive alcohol use among adolescents and young adults has been the brief intervention model. So many of you are probably familiar with the model of brief interventions, which is typically framed within the ESPERT framework, or the screening, brief intervention, and referral to treatment model. So the ESPERT model refers to the process by which a screening happens, in which there's an opportunistic administration of a screening instrument that can be used to assess how much are the adolescents or young adults drinking, to assess whether they're drinking at those potentially risky levels, which we know are correlated with those detrimental outcomes. And then brief interventions then follow in this ESPERT model. And so brief interventions will define very broadly here as interventions that are delivered in a brief time frame or a circumscribed time frame. And these interventions broadly aim to promote behavior change, whether that's change in drinking itself or in the determinants of drinking. And then the end of the ESPERT model really refers to referral to treatment. And so for any individuals who may be screening as meeting criteria for an alcohol use disorder and needing more intensive specialty services, those individuals then might be referred out to specialty or more intensive services. So it is important just to clarify that today's panel really will be focusing on the BI part of ESPERT, so we're not focusing so much on the screening or referral to treatment, but really what we'll be discussing is the evidence around the effectiveness of brief interventions for reducing alcohol use and alcohol-related consequences among adolescents and young adults. Now, you may have noticed that definition of a brief intervention was relatively broad. And so brief interventions really refer to a family of interventions that can vary widely in terms of duration, the delivery format, the location in which they're delivered, and also the underlying theory of change. So some of the common theories of change or intervention philosophies that are used to inform brief interventions tend to be cognitive behavioral or motivational enhancement approaches, but also a reliance typically on social norms theory and the trans-theoretical model of behavior change. Now, there are also a wide range of active ingredients or components that may be used in brief interventions. And I've listed some here, including personalized feedback, skills training, and provision of resources. But I'll walk you through a couple of examples of what these brief interventions typically entail. And again, these are often delivered in 10 minutes or 50 minutes, typically no more than a few hours of contact time with the participants and the intervention providers. So some of the common types of intervention components that might be used in brief interventions for adolescents and young adults. One example are personalized normative feedback reports. And so again, these are often based on social norms theories, which try to address the issue of excessive drinking among youth by highlighting discrepancies in students' perceptions of how often their peers are drinking compared to their own drinking. So here you're seeing an example from a personalized normative feedback report from the eChug to Go intervention that's providing normative data. So the students would complete a screening instrument saying how much they're consuming alcohol, and then might be asked in that screening instrument, well, how often do you think your peers in your high school or in a similar local context, how much do you think that they're drinking? And of course, we typically see with adolescent and young adult populations that they are systematically overestimating the amount to which their peers are drinking. So the purpose of these normative feedback reports are often to highlight those discrepancies to those youth to highlight that their peers are not drinking quite as much as they think, and it's not so normative. Another typical intervention component that's used in brief alcohol interventions are decisional balance exercises, or more colloquially, a pros and cons activity, right? And so sitting down with the youth and the intervention provider and talking through the benefits or pros of drinking alcohol and the cons of drinking alcohol, and then highlighting what are the potential pros and cons of potentially making a change, so reducing that drinking to a potentially healthier level, or the pros and cons of not changing. So there are a lot of variations on these decisional balance exercises. So sometimes therapists can ask the participants to weight the different pros and cons to have that discussion. But based on my conversations with clinicians, particularly among youth, this tends to resonate really well with participants because for many adolescents, they often aren't given that opportunity to discuss the pros of drinking, right? And so there's that sort of respect and autonomy that's valued in this decisional balance exercise. So now that you've got a flavor for what brief alcohol interventions tend to look like with adolescents and young adults, I'd now like to transition to a discussion of some of my meta-analytic work, and this will really feed into the other sessions or the other panelists' presentations today to talk about where we're going to try to advance the field. So when my colleague Mark Lipsey and I began working on a meta-analysis of brief alcohol interventions several years ago, we knew that there was a large body of rigorous controlled research evidence looking at the effectiveness of these brief alcohol interventions for adolescents and young adults, and quite a lot of attention around the potential benefit of these interventions given their potential cost effectiveness and their transportability across multiple contexts. Now, at the time at which we proposed our original meta-analysis, we knew that there had been several systematic reviews and meta-analyses examining the effects of these interventions for youth, but very few reviews had focused on what we consider the more interesting questions about for whom and under what context or conditions these interventions may be more or less effective. And so I think we as prevention scientists are often interested in unpacking that black box, right? So we're not just interested in those overall effects, but really interested in teasing out the variability in effects. And so I think you'll see that reflected in the talks today on this panel is really trying to examine this issue of variability or heterogeneity. So our previous meta-analysis that we conducted what we believe to be one of the largest and most comprehensive systematic reviews and meta-analyses of the literature of brief alcohol interventions. And so for our project, we did follow the standard procedures of the Cochrane and Campbell collaborations for systematic reviews. We conducted a systematic literature search to identify all of the potentially relevant studies that had used a randomized control trial or a rigorous quasi-experimental design to compare the effects of a brief alcohol intervention to some inactive comparison condition for adolescents or young adults up through undergraduate age samples. So for this literature, this was conducted now several years ago, and so we synthesized the evidence published between, or reported between 1980 and 2013, and we ultimately identified 190 controlled trials that met our inclusion criteria, resulting in over 1,500 standardized mean effect sizes that we then synthesized using meta-regression techniques with robust variance estimation. So the purpose of today's panel is not to focus so much on the findings from this review, but to talk about where we're going. But I will briefly mention, and I'm happy to share reprints with you of our findings, that the results from that initial meta-analysis of those 190 trials, we found evidence that these brief alcohol interventions did yield modest beneficial effects in terms of reducing alcohol consumption among youth. And so I say modest here because if you examine the effects of these interventions, they tended to yield about a 1-day reduction in drinking days in the past month. And so on average, the comparison condition students were reporting about 6 days of drinking per month, and the brief intervention students were about 5 days per month. We also found evidence that these brief interventions yielded significant but modest reductions in alcohol-related consequences. So for instance, using the Rutgers Alcohol Problem Inventory, these interventions on average were yielding a reduction of around 0.6 on that scale. Now, what was also interesting from our study, again, because we were interested in examining variability in these effects, is that we did find these effects tended to persist for up to 1 year after the brief intervention. So that's actually a very promising finding, given the brevity of these interventions. And we did find that these results were relatively consistent, regardless of the intervention length, right? So up to 10 minutes, up to an hour or 2 hours, and also across delivery setting. Now, we did find quite a bit of variability, however, in the effects of these interventions, depending on the types of intervention approaches and strategies, and also those active intervention components that I was discussing earlier. One of the key findings from our meta-analysis were that these decisional balance and goal-setting exercises tended to be particularly beneficial for the adolescent samples. And so that's actually contrary to what you might expect or predict based on cognitive behavioral theory. But again, speaking with clinicians about these findings, I do think that adolescent samples in particular, that these activities may resonate with them because they're not used to having that clinician respect that they may see some positives in drinking. And so treating them as autonomous, independent actors may yield some additional effectiveness of these interventions. We also found that the interventions that used motivational enhancement therapy or expectancy challenge or personalized normative feedback approaches, those tended to yield larger beneficial effects. And then for a small subset of the studies included in the synthesis, we did find that those studies that were delivering brief alcohol interventions in specifically to college students the week before their 21st birthday, so these event-specific brief alcohol interventions trying to reduce heavy drinking and binge drinking during the 21st birthday, there was no evidence that those specific 21st birthday brief interventions were particularly effective. Now, we also found that the effects did tend to be larger in adolescent versus the young adult samples. And we didn't find evidence that the effects varied significantly by the demographics of the samples. But it's important to note here that this meta-analysis relied on aggregate data. So this is more of a traditional meta-analysis where we're pooling information based on the information that's reported in those reports and studies. And so that's an important issue that I'm going to come back to that's going to resonate with the rest of this panel. So where are we at today? So that literature review that we conducted was current through 2013. And we've seen just a massive explosion in continued research around brief alcohol interventions. So we're currently updating our previous meta-analysis to try to capture that most recent evidence. And so we've registered our update to the systematic review on Prospero. And so we've now completed our systematic literature search and identified 134 new trials that have been published from 2014 forward. So again, we found 190 trials between 1980 and 2013, and now we've seen this exponential growth in the literature. And so this really does point to the importance of updating our review, and really that's what we'll be discussing through the remainder of this panel are some innovative methods and statistical techniques that we're using to try to dig deeper to provide more nuanced understanding of the variability in the effects of these brief alcohol interventions. So you'll hear from some of my colleagues about the additional analysis techniques that we'll be using, including multivariate network meta-analysis models that will allow us to make assessments of both the direct evidence in reported studies as well as indirect evidence. But really what I'd like to focus on here as the potentially innovative part of our updated review is the combination of both aggregate data from study reports and journal articles, but we'll also be combining individual participant data from a subset of these 134 trials. So as I alluded to previously, when we conduct meta-analyses that solely synthesize aggregate data from existing reports, we're limited by including the information about means, standard deviations, sample sizes from those reports. And this also applies when we're thinking about the demographic features of those participants, right? So if we're collecting information from a study about gender, we might code that as the percentage of girls in the sample, but we don't have individual level data about this girl had this outcome, this boy had that outcome. And so that's actually a serious limitation because of the risk of ecological fallacy in terms of making inaccurate conclusions at the individual level based on aggregate level data. As you'll hear from my colleagues, there are also limitations with aggregate data in terms of reliance on these reported statistics in studies that prevent us from accurately and appropriately modeling over-dispersed count data, which are the norm when we're thinking about outcomes like alcohol consumption or substance use consumption. And then again, I think one of the key limitations of aggregate data meta-analysis is that you really cannot do a nuanced examination of participant level or patient level features that might modify the effects of these interventions. So I'd like to pause briefly just to discuss this ecological fallacy, because this is one of the key limitations of aggregate data meta-analysis, is that when you're relying on those aggregate study data, you run risk of running into this ecological fallacy where you may erroneously draw conclusions at the individual level based on analyses of group data. So here I've just provided you an example of an extreme case where the ecological fallacy might occur. So for instance, if we conducted a typical aggregate data meta-analysis where we synthesized results from 3 studies, if we were interested in how intervention effects might vary depending on the age of the participants, if we only had the aggregate study level data from these 3 studies, we might erroneously conclude that there is a positive relationship here, and so you see that with the dotted line, so that older age participants show larger intervention effects. And again, this is a very extreme example, but it's quite possible and plausible that those individual level data, had we had access to them, might have actually shown the opposite direction of effect, so that within each of those studies, you might have actually observed a negative relationship between participant age and intervention effects. And so this is really one of the key values from my perspective of individual participant data meta-analyses, because we're often, again, interested in these precision medicine questions around for whom do these interventions work best? And we can't accurately answer those questions if we're relying solely on aggregate level data. So my colleagues will be discussing some of the unique additional benefits of IPD here, but really just to summarize briefly, our prior aggregate data meta-analysis did show potential promise in these brief alcohol interventions for reducing alcohol consumption and alcohol-related problems among youth. And we do believe still that aggregate data meta-analyses can provide useful information about overall effects and also variability of effects across study level characteristics, such as the context in which the intervention was implemented or the setting or the intervention components. But if we want to address these precision prevention questions about for whom these interventions work best, we absolutely must use individual participant data methods in our research syntheses. So with that, again, we will hold questions until the end. And so I will now turn this over to my colleagues.